Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is 12 practice NCLEX questions. Without delay, let's get started.
A female client diagnosed with lung cancer is to have a left lower lobectomy. Which of the following increases a client's risk of developing postoperative pulmonary complications? 1. Height is 5 feet 7 inches and weight is 110 pounds. 2. The client tends to keep her real feelings to herself. 3. She ambulates and can climb one flight of stairs without dyspnea. 4. The client is 58 years of age. The correct answer is 1. Risk factors for postoperative pulmonary complications include malnourishment, which is indicated by this client's height and weight. It is thought that emotion responses can affect overall health. However, not verbalizing one's feelings is not a contributing factor in postoperative pulmonary complications. The client's current activity level and age do not place her at increased risk for complications. When caring for a client with a chest tube and water-sealed drainage system, the nurse should 1. Verify that the air vent on the water-sealed drainage system is capped when the suction is off. 2. Strip the chest drainage tubes at least every 4 hours if excessive bleeding occurs. 3. Ensure that the chest tube is clamped when moving the client out of the bed. 4. Make sure that the drainage apparatus is always below the client's chest level. The correct answer is 4. The drainage apparatus is always kept below the client's chest level to prevent backflow of fluid into the pleural space. The air vent must always be open in the closed chest drainage system to allow air from the client to escape. Stripping a chest tube causes excessive negative interpleural pressure and is not recommended. Clamping a chest tube when moving a client is not recommended. A client who is recovering from chest trauma is to be discharged home with a chest tube drainage system intact. The nurse should instruct the client to call the physician for which of the following? 1. Respiratory rate greater than 16 breaths per minute. 2. Continuous bubbling in the water-sealed chamber. 3. Fluid in the chest tube. 4. Fluctuation of fluid in the water-sealed chamber. The correct answer is 2. Continuous bubbling in the water-sealed chamber indicates a leak in the system, and the client needs to be instructed to notify the physician if continuous bubbling occurs. A respiratory rate of more than 16 breaths per minute may not be unusual and does not necessarily mean that the client should notify the physician. Fluid in the chest tube is expected, as is fluctuation of the fluid in the water-sealed chamber. A 12-year-old with leukemia is receiving cyclophosphamide. The nurse should assess for the adverse effect of 1. Photosensitivity. 2. Ataxia. 3. Cystitis. 4. Cardiac arrhythmias. The correct answer is 3. Cystitis is a potential adverse effect of cyclophosphamide. The client should be monitored for pain on urination. Photosensitivity, ataxia, and cardiac arrhythmias are not adverse effects associated with cyclophosphamide. A 10-year-old with leukemia is taking immunosuppressive drugs. To maintain health, the nurse should instruct the child and parents to 1. Continue with immunizations. 2. Not receive any live attenuated vaccines. 3. Receive vitamin and mineral supplements. 4. Stay away from peers. The correct answer is 2. Children who are immunosuppressed should not receive any live attenuated vaccines. Clients who are immunosuppressed and are given live attenuated vaccines, such as measles, mumps, rubella, and oral polio vaccine, can develop severe forms of diseases for which they are being immunized, which can result in death. Inactivated vaccines may be given if necessary, but the client is not able to adequately produce needed antibodies, and it is recommended that immunizations be delayed for 3 months after the immunosuppressive drugs have been discontinued. Vitamin and mineral supplements are not normally given in conjunction with immunosuppressive drugs. When the client is immunosuppressed, the client should avoid only persons who have an infection. The primary healthcare provider prescribes 1,000 milliliters of Ringer's lactate intravenously over an 8-hour period for a 29-year-old prima gravida client at 16 weeks gestation with hyperemesis. The drip factor is 12 drops per milliliter. The nurse should administer the IV infusion at how many drops per minute? Blank drops per minute. The correct answer is 25 drops per minute. The formula is set up as 12 drops over 1 milliliter times 1,000 milliliter over 8 hours times 1 hour over 60 minutes. You multiply everything and you get 12,000 over 480. You divide 12,000 by 480 and you get 25 drops per minute. A client has just had a cesarean section for a prolapsed cord. In reviewing the client's history, which of the following factors places a client at risk for cord prolapse? Select all that apply. 1, -2 station. 2, low birth weight infant. 3, rupture of membranes. 4, breech presentation. 5, prior abortion. 6, low-lying placenta. The correct answers are 1, 2, 3, and 4. Having the fetus at a negative station places a client at risk for a cord prolapse. With a negative station, there is room between the fetal head and the maternal pelvis for the cord to slip through. A small infant is more mobile within the uterus, and the cord can rest between the fetus and the inside of the uterus or below the fetal head. With a large infant, the head is usually in a vertex presentation and occludes the lower portion of the uterus, preventing the cord from slipping by. When membranes rupture, the cord can be swept through with the amniotic fluid. In a breech presentation, the fetal head is in the fundus and smaller portions of the fetus settle into the lower portion of the uterus, allowing the cord to lie beside the fetus. Prior abortion and a low-lying placenta have no correlation to cord prolapse. A 77-year-old client is brought to the emergency department by her son. The client has severe headache and lack of sleep because I'm so worried about everything. Her son says that she has heart failure and chronic schizophrenia. In addition to all of her heart medicines, she is on aripiprazole, which was increased to 30 milligrams by her family doctor 3 days ago. In addition to documenting all the client's medications and exact dosages, the nurse should particularly investigate which of the following? Select all that apply. 1, the qualifications of the client's primary care provider. 2, the client's symptoms of schizophrenia. 3, the dose of aripiprazole. 4, the client's symptoms of heart failure. 5, the client's relationship with her son. The correct answers are 2, 3, 4. The client's symptoms are likely to be adverse effects of aripiprazole, especially at the reported dose. The normal adult dose is 5 to 10 milligrams. The elderly client commonly needs a lower dose compared with other adults. The anxiety and sleep disturbance could be symptoms of schizophrenia or medication adverse effects. A holistic approach would include assessing the client's heart failure. Questioning the qualifications of the family doctor is unproductive. There are no indications of problems in the client's relationship with her son. A client with chronic undifferentiated schizophrenia reports doing very little all day except sleeping and eating. The nurse should 1, have 3 meals per day brought in to increase the amount of time the client spends out of bed. 2, ask a relative to call the client at least 10 times a day to decrease the sleeping. 3, help the client set up a daily activity schedule to include setting a wake-up alarm. 4, arrange for the client to move to a group home with structured activities. The correct answer is 3. The client with CUS needs more structure every day to improve functioning. Therefore, helping the client to set up a daily activity schedule is most appropriate. However, a group home is not necessary. The client is already eating. Having meals brought in would increase the client's dependence, not his activity level. Asking a relative to call the client 10 times per day is unrealistic given the typical daily responsibilities of a healthy relative. The nurse is planning care for a group of clients who are chronically mentally ill. Which of the following strategies is likely to be the least beneficial for the client population? 1, teaching independent living skills. 2, assisting clients with living arrangements. 3, helping clients in insight-oriented therapy. 4, linking clients with community resources. The correct answer is 3. Insight-oriented therapy is less beneficial for this client population. The nurse's role in a psychosocial rehabilitation program involves teaching the client to live independently by using interpersonal skills and community resources. The nurse in the perioperative area is preparing a client for surgery and notices that the client looks sad. The client says, "I'm scared of having cancer. It's so horrible and I brought it on myself. I should have quit smoking years ago." What would be the nurse's best response to the client? 1. It's okay to be scared. What is it about cancer that you're afraid of? 2. It's normal to be scared. I would be, 2. We'll help you through it. 3. Don't be so hard on yourself. You don't know if your smoking caused a cancer. 4. Do you feel guilty because you smoked? The correct answer is 1. Acknowledging the basic feeling the client expresses fear and asking an open-ended question allows the client to explain any fears. The other options dismiss the client's feelings and may give false reassurance or label the client's feelings. The client should be encouraged to explore feelings about a cancer diagnosis. A client has a chest tube attached to a water seal drainage system, and the nurse notes that the fluid in the chest tube and in the water seal column has stopped fluctuating. The nurse should determine that 1. The lung has fully expanded. 2. The lung has collapsed. 3. The chest tube is in the pleural space. 4. The mediastinal space has decreased. The correct answer is 1. Cessation of fluid fluctuation in the tubing can mean one of several things. The lung has fully expanded and negative intrapleural pressure has been reestablished. The chest tube is occluded, or the chest tube is not in the pleural space. Fluid fluctuation occurs because, during inspiration, intrapleural pressure exceeds the negative pressure generated in the water seal system. Therefore, drainage moves toward the client. During expiration, the pleural pressure exceeds that generated in the water seal system, and fluid moves away from the client. When the lung is collapsed or the chest tube is in the pleural space, fluid fluctuation is likely to be noted. The chest tube is not inserted in the mediastinal space.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.